Hello, everyone. My name is Erica Nicholson, and I have decided to focus my presentation on the use of various technologies to enhance student engagement in nursing education. The use of technology is very important when it comes to keeping students engaged in learning. Various methods can be used to encourage interactive learning and increase student engagement. Flipping the classroom method, simulation scenarios, and the use of mobile devices can all aid in the learning process in nursing education. This topic needs discussion to allow educators to move from a linear way of teaching into a more interactive way of learning for their students. Students will be able to identify various types of technology that can be used to increase student engagement. Students will also understand the importance of using technology in nursing education to enhance student engagement. Flipping the classroom. The flipped classroom approach is an innovative teaching method to promote students' active learning. The purpose of this article is to describe the process of developing a flipped classroom approach for an undergraduate evidence-based nursing practice course and discuss lessons learned from the process and evaluation data. Some of the pros that came from this approach. The flipped classroom approach is a promising approach that promotes active learning and accommodates a variety of learning styles. It's also a way to promote active learning, which encourages students to use problem solving in multiple senses in their learning and to apply the knowledge they gain. Another pro is that these classroom lectures are moved from being lectured in a classroom to pre-class work, which makes more time for interactive learning in classes. Students can learn the course content independently by reading and listening to a recorded lecture or reviewing an assigned video outside of class and then come to class more prepared and engaged. With pros, you do have cons. This is a new method of learning, and students are accustomed to the traditional lecture, so you will meet some kind of resistance. This method also includes the need for advanced planning, which can also be time consuming, but planning in advance and preparation has a long-term payoff. This article found that the pre-class online modules had a high completion rate and students scored as instructed on the post quizzes over 80%. Students were able to identify strengths and areas of improvement that were highly connected. Recommendations. With the use of technology, instructors can create a learning environment that accommodates different students' learning speed and styles. Above all, the flipped classroom approach allows students to focus on application of course material, be an active learner, and take ownership of their learning. If more instructors use the flipped classroom approach, students will be accustomed to its expectations and you may meet a little less resistance. The purpose of this article is to describe the process of using a high fidelity simulation scenario as an unfolding case study to teach students how to manage and care for a patient. The goal is to use this as a tool to teach systemic decision making in the classroom and allow a large group of students to develop abstract thinking and gain experience in a setting that has traditionally delivered information in a linear format. Pros. Active teaching strategy improves student learning outcomes. Interactive teaching strategies promote clinical judgment, critical thinking, confidence, knowledge retention, improve clinical skills, and a higher level of comprehension for nursing students. Various interactive teaching methods are suggested in the current research, including unfolding case studies, flipping the classroom, and others. Some barriers may include lack of time, resources, and space to complete simulations for small groups of students, and it may also include ineffective orientation and training of clinical faculty. This article found that students were engaged and eager to talk about the patient and the scenario. The victim brought a sense of excitement to the classroom with a good visual example of the topic being covered. The students as a whole did well on the exam, and average scores were in the high 80s. Recommendations include that the simulation classroom setting facilitates a controlled environment for these important and necessary aspects of student learning. Working through case studies and scenarios in the classroom allows learners to pause and consider all aspects of the nursing process. Also, another recommendation would be to use smaller groups to keep engagement. The purpose of this pilot study was to identify current use of mobile device technology by nursing faculty, staff, and students, to compare and contrast policies and practices relating to mobile technology in nursing education, and to make recommendations to better align teaching strategies and learning outcomes. Use of laptop computers, PDAs, iPads, and smartphones in both the classroom and clinical setting have increased. Pros: the use of mobile devices in the clinical setting may allow an opportunity for students to take personal responsibility for learning and being accountable for their education. Some barriers include using a mobile device in the clinical and education settings were related to infection control, use of social media, etiquette, costs, confidentiality, policy limitations, and lack of knowledge about available clinical applications. This article found that the use of mobile devices as learning tools enabled them to look up pertinent information that made them more knowledgeable and prepared to properly care for patients. It also gave students instant access. One student quoted, "Mobile devices allow us to access information specific to patient care. Patients may have questions we need supplemental information to help answer, and devices gives us that hands-on access." Recommendations. To fully appreciate the utility of technology, a number of barriers need to be addressed first. The Technology Committee addresses these gaps and barriers. Sharing the knowledge with others will allow them to ask the question: are there gaps between differing technologies used by faculty, staff, and students that prevent quality interface within our curriculum? Future research should include surveying clinical site administrators and patients regarding their perceptions regarding the use of mobile devices in the clinical setting. Continued support and monitoring on the use of mobile devices in the clinical setting needs to be encouraged and implemented at all clinical sites. Various technology use is needed in the classroom to enhance student engagement. Flipping the classroom, simulation, and mobile technology are all examples of things that can be used to help enhance the engagement of students in nursing education. Evidence-based research has proven that the use of technology creates a more interactive way of learning and better test scores. Recommendations. Educators should use the flipped classroom method approach to allow students to focus on the application of course material, be an active learner, and take ownership of their learning. Using simulation in a classroom setting facilitates a controlled environment for students to critically think and work through different scenarios or case studies. Continued support and monitoring on the use of mobile devices in the clinical setting needs to be encouraged and implemented at all clinical sites. I hope you I hope you guys I hope you guys have enjoyed my presentation. Below I have listed my references used for this presentation. Have a great day.